Hello, everyone. Hello. We will be getting started shortly. Thank you guys so much for coming. So my name is Brittany Hughes. I am the Legislative Director for Congresswoman Underwood. If you have not already learned that, there are many, many hours together today. It's a pleasure to have you all here and joining us for our second panel of the afternoon entitled, Unlocking Federal Dollars, How to Get Momnibus Funding for Community-Based Organizations and Local Governments. So if you are working closely with a community-based organization or a local government, this is definitely for you, and we are excited to have you all join us. Today we are joined by Sarah O'Connor, who is the Chief Division of Population Health Management, who is the Chief at the Division of Population Health Management here in Illinois' Department of Public Health. Dr. Anita Thuricall, Senior Advisor, Maternal and Child Health Bureau, Health Resources and Services Administration, also known as HRSA, HRSA, at the U.S. Department of Health and Human Services. We have Rosalind Moore, Deputy Director for Programs, Office of Minority Health at the U.S. Department of Health and Human Services, and Dr. Kenya McRae, who is the Visiting Research Assistant Professor, Department of Medicine at University of Illinois, Chicago. So quite a few people here from Illinois, which we're excited about. And we will go ahead and jump into things. Dr. Thuricall, Director O'Connor, and Director Moore, this first question is for you. I want to say thank you all so much for being here. Could each of you briefly talk to us about the maternal health initiatives and funding opportunities led by the agencies or institutions you represent?
Sure. So I'm happy to start. Let me make sure that it's close this round. So good afternoon, everyone. My name is Anita Thuricall, and as mentioned, I was also on the previous panel, so apologies for any repetition, but just to make sure that everyone is on the same page. So I'm a senior advisor in the Maternal and Child Health Bureau, MCHB, of HRSA, the Health Resources and Services Administration's the agency within the Department of Health and Human Services, and at MCHB, our mission is to improve the health and well-being of America's mothers, children, and families. And for us, we have a vision of an America where all of our mothers, children, and families thrive. And so our investments are really looking to reach that aim and that goal. And for most of HRSA's work, it's programmatic in nature and is built around health systems and supporting health systems in many ways, shapes, and forms. For MCHB, we reach an estimated 61 million pregnant women, persons, children, families, and we do this through a number of different investments. So Congress passed the budget for the 2024 fiscal year and approved a $1.69 billion spending budget for the Maternal and Child Health Bureau alone. And this included funding for a range of maternal health efforts across several categories of work. So I have a slide that has just some of the ones that are more, maternal health focused. This is perfect. And so we look to have, and this is just some of our main focus and work streams in maternal health, but we have funding to support state systems and innovations. We have funding looking at workforce quality and improvement, so funding to just bolster maternal health workforce and improve quality of care. We have funding also for direct support and services to fund direct services to families. And I just want to highlight a few things. So I think, if you're approaching this just from a community-based organization perspective, one of the first places that I would recommend folks reaching out to, if you haven't already, is your Title V program. So Title V is one of the largest investments that are provided by the Maternal and Child Health Bureau. This is the investment that is reaching 93% of pregnant women, 99% of infants, 61% of children. And each state, so each of 59 states, it's a partnership basically between the federal government and states, and it really has a lot of flexibility for states and jurisdictions to do what is needed in their local communities to address needs. So every state or jurisdiction will have a Title V program. So if you're not in touch with your Title V program already, I would just recommend reaching out to your health department and setting up a meeting, talking about the work that you do, and trying to build those partnerships and those connections. But they are a great place to start, and as stated, they have such great reach and can really help to build that partnership and just set wheels in motion to make the work begin. Another, I think, helpful resource for community-based groups is looking at the work of the Maternal, Infant, and Early Childhood Home Visiting Program. So this is our evidence-based home visiting program. It's built on decades of research that just shows how visits by a nurse, social worker, early childhood educator has the potential to just improve the lives of children and families exponentially. So it's been shown to prevent child abuse, encourage positive parenting techniques, improves maternal and child health, and has an array of different advantages. But another great program to just reach out to see if there are any kind of synergies that exist between your work and theirs. Another program that takes a more community-based organization perspective is the Healthy Start program. So Healthy Start is a program that serves communities with infant mortality rates that are 1.5 times the U.S. national average, and or have other perinatal health outcomes that are in need of support. And so through Healthy Start, there are grants that are given to, some of the grants are given to health departments who implement services directly. Some are given to community-based organizations that implement services, but there's work around care coordination, case management, different supports just for various social determinants of health issues. So some Healthy Start programs give help with housing if their clients are having difficulty in that space, rental assistance, getting connected to health insurance, everything and anything that come up, they can help support. I think that's a touch of just a flavor of some of the grants that we have that are more community-based and oriented, but feel free to reach out. You can look up any of these grants that are here. If you have any questions, please reach out to me. Also after, I'm happy to talk more about anything that we have at HRSA.
Well, that's tough to follow. My name is Rosalind Holliday Moore, as you heard, and I serve as the Deputy Director for Programs at the Office of Minority Health for one reason. Because I know, having been in communities as you have, that if we don't make better connections, the data on health disparities will not change. So in sitting here today, it is with one purpose in mind. I know, as I look across the room and as I scanned the audience earlier, many of you do not know about the Office of Minority Health. Thank you for affirming that. So we're going to start there. The Office of Minority Health is very unique, both by mission and statute. We are the only office in federal government with a sole mission to focus on racial and ethnic minority populations, American Indian and Alaska Natives. One. And we want to work with you. First takeaway from my presentation. We also know, in order to work with you, particularly in the area of maternal health, we need to do a few things differently. One, we need to make sure information about our resources are available to you in a way that you can receive them. That's why I'm here. We were very fortunate last year to be able to award grants for the Healthy Families Community-Based Perinatal Initiative. Many of you know it as COFI. This initiative is a direct result of the Momnibus Act as it is emerging. 11 communities, $13 million. September 2023, important for us. Because we have noted now that in less than a year, these 11 communities have partnered. They don't know each other, but they know each other now. They have organized themselves around key pillars of work and have produced outstanding results. For the data scientists around me, I know we don't have true results. But for the community person that I am at heart, they matter. They matter in the area of engagement, community partnership. They matter in the area of data, understanding data in a different way, not from the large data sets that we all acknowledge as abysmal for our nation, but the data sets that are identifying, archiving innovations that work, innovations in the areas of social determinants of health and in our social networks of health. So we're learning more about the way in which doulas and community health workers are making significant change. We're learning about how we can create data systems that incorporate the voices of community members, not just numbers that we crunch, but all of the accolades and the sorrows that matter. We're learning about cultural and linguistic competency. It is not enough to take a course and say that I have a certificate after sitting in a room for an hour. It is important to be a part of conversations, difficult conversations sometimes, to change the narrative of how we talk with each other and how we are with each other. That's the Office of Minority Health. We are here to connect and change the narrative. We are working in a way to frame our portfolio around programs, policies, and practices that you tell us work. All of our grant initiatives have an evaluation component. That data will become available for you, and it is our ask that you use it. Now, I started with, I know many of you aren't getting funding from the Office of Minority Health. Nobody disputed that fact. So I also want to offer a few things that you can use today. And I can track today. So if you don't take me up on this invitation, I might just come back. In the area of cultural and linguistic competency, on the Office of Minority Health website, you will find a suite of e-learning programs. These programs are 24/7 available at no cost, and we have one dedicated to maternal health. Completing the course means you get credit for those who early professionals emerging and looking for credits, those who are seasoned and you still need credits to maintain your certification. Take the course. It's easy. And it's not 8 hours. It's intentional, and it incorporates the voices of community members to make sure the content is aligned with what you need. If you have not subscribed to the Office of Minority Health, please do so. We send out regular newsletters to help you know what we're doing, when we're doing it, and how we might do it with you. I also can tell not too many people are subscribers. It is so important for us to be connected beyond this moment. And last but not least, scan our website. We're upgrading it. Thank you for that good feedback. We're making it easier. And you'll find resources that others have developed and want to share with you. When we get through this, I have a few other tips, but I don't want to hog the microphone because, of course, my colleague here has a lot to share. But thank you so much for your attention, because it means more than you can imagine to be able to hear directly from you to improve what I do when I go home. Thank you.
I have two tough ones to follow. My name is Sarah O'Connor. I am with the Illinois Department of Public Health, and I work in the Office of Women's Health. And we are that Title V program that was mentioned with the first speaker. We have many different programs within Title V, and I don't want to be discouraging, but not everyone is a grant program you could just apply for. There are criteria, school-based health centers, adolescent, perinatal centers. I mean, there's certain things, but it would behoove you in your communities, if you are a unit of local government or a school, that's what I was told, these are your community members, community-based organizations, nonprofits, that you know what's going on in your communities. And I'm happy to get you a list at any point, connect you with those people, because just because you might not be able to apply for the grant yourself, you can certainly be a collaborator, a subcontractor, a partner, very much so. There's just never too much of that. But we have the Title V program, as mentioned, many different things in the world of maternal and child health. What I really want to talk to you about today is just navigating our electronic grant system that the Illinois Department of Public Health has. We have so many organizations all the time. We have usually about a 30-day window, which I know will be the next question, timeline. But so many organizations find out about these grants a little too late, and then you need to go through the red tape that we have. I mean, it's just what it is. We're a government. You have to register in our system called eGrams. You have to make sure you're registered in the GATA portal, all that sort of stuff. So I'm happy to share any of that with you. Those are great things you can do ahead of time. And the other really wonderful thing about eGrams, our electronic grants management system, and it stands for something I don't use ever, I just say eGrams, is that you can register to receive notifications of any new funding opportunity that comes about. So not just in the Office of Women's Health, but the Office of Minority Health, the Office of Health Promotion, because we have a state Office of Minority Health as well. Anytime that you wanted to hear about any funding opportunities, you could get a notification, and then you'll know in ample time to do that. And then that gives you time to register in eGrams, create your profiles, all that sort of stuff that you don't want to take away from that 30-day applicant window. So I could go on and on about our grants. You guys have heard a lot probably all day today, and I'm happy to stay afterwards and talk to anybody, but we do have the Title V program that's administered out of our office, and we do our best. There's always so much more to do, but we do grants. We do a lot of grant opportunities. We work with incarcerated women. We're shipping breast milk to families of women who can't come and pick it up. We're trying to be innovative. We're offering doula services to any incarcerated woman who doesn't have support, even if she does have support, who couldn't benefit from having more support. We try to be out-of-the-box thinkers as much as we can within the limitations we have to, but that's what we look to any of you for, those great ideas and great thoughts. We can't do it all, but we certainly listen and we certainly do our best. So that's all I've got.
Thank you all so much. That's incredibly informative information. I think what I got from it was the importance of just connectedness and being tuned in and tapped into what your various agencies are doing. And so if you all could, and I know you've shared in part some of this already, but if you could just share more about the general life cycle of grants at your respective agencies, when they open, how long they are open for, and which are expected to open in the coming months so that the audience may be aware.
Sure. So shared a little bit of this the last panel, but just for anyone who may not have been at the last breakout session, So MCHB's funding opportunities become available at different times during the year. Usually the summer months, fall months are when you see them pop up more frequently. And the availability will usually be up for about 2 to 3 months. And that's just, to allow enough time for people to gather the required information and have that time to apply. Generally, for HRSA grants, once you apply, it takes about 5 months for award notifications to come out. And in terms of helpful resource or where you can go to find more, grants.gov is a great resource. There you can filter by different agencies, you can filter by topics, you can filter by eligibility, so what type of organization you are, what type of funding opportunities you're looking for, and it's just a great resource to see what sorts of grants might be coming down the pike. So looking at forecasted grants are items that might be showing up on the president's budget in different pieces of language that we have some indication that we might get some funding, and there'll be a short, brief description. But you'll also have the posted opportunities, which are the full notice of funding opportunities that say what applications need to speak to. And so grants.gov, great resource. The HRSA website also has a lot of resources, but yes, that's a general life cycle and some quick places that you can go for more info.
Well, I'm going to build on that a little bit. And also, full disclosure, I've been where you are, so I know that sometimes the translation of our message is important. So grants.gov, I'm a fan. Absolutely encourage everyone to go there. But for the Office of Minority Health, for reasons that are much too granular to describe, it is very difficult to find the Office of Minority Health at that spot. You have to have the right code, the right numbers, all those things. So I'm going to give you another route. You'll end up at the same place. So if you go to the Office of Minority Health website, look under Funding Opportunities, the tab is at the top toolbar. We have linked our forecast information for the upcoming year on our website to make it easier. Our grants follow the federal budget cycle, and our forecasts come out 60 days in advance of the announcements, give or take a day, because you know how schedules go. But 60 days is the standard. We have put all of the information that we anticipate at this point in time on our website. It is also posted on grants.gov. We also know that it takes time to write. So we aim to have our awards information, the funding opportunity information, available 90 days ahead of when the application is due. That is not always possible. Right now, we're aiming for that. 60 days is the minimum. So it's 60 to 90 days. In order to meet that timeline, that means you've already gotten started, because that's aggressive, we know. It's important when you're thinking about funding opportunities to get your partners network together, think about your financial infrastructure, all those budgeting things that we don't like to talk about from a programmatic perspective. They matter when it comes to a grant application. We also know that the electronic submissions, we have that too. There's a point in common. It's really important not to wait to the last day at the last hour, because very often the systems collapse and it's hard to beg for that exception. It looks like you're ready now. We're also ready now. So I encourage you to go on our website which will get you to grants.gov. And if you need any help, please use the names that are listed on the announcement. The forecasts come with people who can help you. Please don't hesitate to accept that invitation.
Thank you. And sorry, Mr. O'Connor, before we move to your answer, I just want to reiterate that the Office of Minority Health that we are referring to is at the U.S. Department of Health and Human Services. So HHS, because I know some other agencies have it, but we are talking about the Office of Minority Health at HHS. So thank you.
Got it, thank you. And I don't think ours is up there, but another website, because you just want to jot it down or not remember it, because I can put it on a card for you afterwards if you want to. But our grants website is www.idphgrants.com, not gov.com. And our timeline is on the state fiscal year, so anybody that's ever worked with grants, and even if you haven't, just a timeline in general, you work backwards from the time it's due to working backwards to figure out what you need to start preparing for. So our grants are on the July 1st to June 30th timeline. So we generally try our best to post them by March or so. We are requiring for all of our programs now to do technical assistance workshops. So we post our grants for 30 days, sometimes 45, depending on the nature of it and how much is involved. But a 30-day posting, and about that midpoint mark, we'll do a technical assistance workshop. We'll give you an opportunity to look at it, gather your questions. We'll do a TA workshop, and it's disappointing how few people take advantage of that. We have to figure out how else to get people to notice it, but they're in the what we call a NOFO, the Notice of a Funding Opportunity. It's in there. We do everything via WebEx at Illinois, the state of Illinois, and yeah, it's a little disappointing sometimes. We might have 4 or 5 people that show up, and we go through everything. We go through every part of the application. We go through the really complicated. It's a whole nother language to me. De minimis, indirect, direct, all that complicated stuff. The modified something, fiscal people understand. It's very complicated, and our fiscal person joins us on the calls, and she goes through it, because those are the things that hang you up when you're trying to submit those applications. But I've got my tips for the next question that I'll share with some of those tips that I've seen. But no, it's a 30-day cycle. Our grants that are competitive, we have to be cognizant that it's a competitive nature, so we will take questions, but we can't get into too much details. We usually refer you back to the NOFO, or we share the frequently asked questions and the presentation that we did at the TA. If you missed it, we take whatever we can, and generally they're usually not content questions. They're usually system questions, which are easier to answer. So, but yes, we try to, it's many months ahead of time planning, and that's why I'd encourage you to sign up on this idph.grants. There's a funding opportunity right in the left-hand, I'm looking at it in my head, left-hand column where it lists everything, where you can go right to funding opportunities and choose whatever offices you want funding opportunities for, 1 or 2 or all of them, and you'll get those in ample. Whenever we go, it's called go live, you get the notification that it's out there for you.
So just going to reemphasize some of the websites we've heard in this conversation. Grants.gov, also idph.grants.com.
idphgrants.com.
idphgrants.com. So idphgrants.com. And Minority Health at the U.S. Department of Health and Human Services, their website where you can see the forecast, and then go to grants.gov. For our next question, Dr. Kenya McRae, I want to thank you for joining today's panel. I Promote IL has both received federal funding and administered subgrants. Could you share a bit about this experience, what grant you received, what your hopes for this funding are, and what your experience applying for this funding was like?
Sure. Can you all hear me okay? You thought you weren't going to hear my voice today. So it's just great to be here with all of you. I am following my supervisor. She was here at the last panel, Dr. Rachel Caskey, but I'm going to tell you a little bit about one of our particular projects, and it's called I Promote Illinois, and I will tell you it means innovations to improve maternal outcomes in Illinois. So they say I Promote, and it actually is a HRSA-funded grant. Thank you. And it was 5 years. We received it in 2019, and actually ends in September of this year. but we've already applied for another one. So during this particular grant, initially when the NOFO came out, or the notice of funding came out, it was several people could apply for it. Either your Title V, which is with IDPH, or we're with the university, but you had to be tied to the Title V. So we worked in collaboration. That's one of the big things that UIC does. We work in collaboration with our state health department. Our Title V team is very small. Okay, so let me give a little disclaimer. I was with IDPH in the Title V team prior to joining UIC. So because we help to support them and give them additional capacity to do different things. It's a small team, and not saying that UIC, in particular our team, is huge, but we can actually leverage each other's expertise. And so UIC actually applied, but they were partnering with IDPH. And within this grant, it was to improve maternal health outcomes, as it states. And one of the things that was involved was creating a task force. The iPromote has 125 individuals on its task force, so you can imagine what that is like. But it brings in different perspectives and things of that sort. So it's great to have that type of engagement. It includes individuals with lived experience, and I like to say lived expertise. It includes our physicians. It includes our community-based organizations and all. And so this particular task force, it came out with an agenda. It has a strategic plan that's on the website, and I'll get that in a minute. But it was focused on actually making an impact. So some of the things that they did, Dr. Caskey already said they tried to help train physicians in the emergency department for when they receive pregnant women and asking the proper questions. They also worked with doulas and midwives, getting them together to hear their perspectives, and also helping to try to coordinate what would it look like for like Medicaid to include them in payment for reimbursement. They also looked into the 12-month postpartum after, with Medicaid. They also did some write-ups on telehealth, because we were in 2019 to 2024, we were in the middle of COVID. And so it was important to be able to share that information with providers as well as individuals in the community on what to expect or what to ask. Trying to think of what else they did. They did a whole slew of different things, but I'll stop there. But as I said, one of the main things is to get individuals engaged. And so we are applying for the second iteration. And we will hopefully hear something at the end of September. This next iteration of the Maternal Health Innovation, or iPromote, it's going to have still the task force, but we made it a little smaller, which will have a lot more state involvement from the different agencies and a few different community organizations and other key groups. But then we're having everyone who was in the original task force, 125, they were going to create a learning collaborative, because we realized that that really was where you could share, where you could find someone that you could work with. As you've already heard, it is important to make connections. You might not have all the skills, but you may have enough, and you put it together with someone else that has enough, and then you all can go in together and do a grant. It is not a zero-sum game. Everyone can get an opportunity to work and help and move their agenda forward. Another thing that we're having is a maternal health advisory board. That maternal health advisory board are individuals with lived expertise. They are going to be there, not just someone that we go to and say, hey, look at our information, give us some feedback. They're supposed to be involved in every aspect of this particular grant. So any research that we do, any innovations, they should be weighing in and be able to tell us, no, that's not the way to go, or maybe you might want to rethink certain things. They're going to be interacting with that learning collaborative to be able to help say, okay, yes, different organizations, you have all these different programs, but how do you really get it to the people? How do you really get it, make sure that our voices are heard? So those with lived expertise, they are getting paid. Just as I think it was Dr. Broner, did I say that correctly? I live streamed the morning part, but I heard her say, you're going to talk about bottom up, but you're not paying. They should be valued community members should be valued just as much as your physicians or anyone else that gives health, your health professionals. So I probably went over, I apologize. I'm trying to make sure I cover everything. But really quick, one of the other things, as I said, we collaborate with other individuals. People can be a part of this particular program. And we, one other key thing, UIC is also being charged with creating the Illinois Maternal Health Blueprint. So here's a plug that I'm putting out here. The governor has said that he wants to make Illinois the beacon on the hill, the model state for maternal health, whether reproductive health, pregnancies, whatever have you. And one of the things that we're doing, we have a landscape survey, trying to find every single individual and organization that's doing something in maternal health. We know some, we don't know all. We're not in all the communities. And so if you want to be a part of that survey and participate in the blueprint and in some of these other things that we, like I said, the Learning Collaborative, let me know and I will send you information. I have no problem sharing.
Thank you. Thank you. It's important to share knowledge. So I encourage all of you while you're here to please take advantage of our amazing panelists. Sorry, that means you guys get bombarded after, but we want to make sure the dollars get to the communities that need it most. My question to all of our panelists is, from your experience, could you kindly walk our audience through some of the best practices and general advice on finding and applying for these grants?
Can I go first?
Absolutely.
Okay. So one of the things that I would say for IDPH grants, you definitely want to get on that eGrams website. You want to set your account up. If you know you're going to be applying for grants, get on their website already and go ahead and register yourself. It's going to tell you to go to the GATA portal. I can't put it into words what that means, but you need it. So go and get on that as well. Figure out the different things. It's going to ask you a whole bunch of different questions from like the unique entity identifier, or UEI. Some of you may not have any idea what that is. Some of you may have that. But if you get started, you can figure out each of the pieces so that you're not running around scrambling when you actually see something that you want to apply for. Another thing that I want to say, as I said, make sure you look around to those that you might be able to leverage their talents. Go in together on a research, on a grant. Also, there's opportunities within, like for our maternal health grant, our I Promote, there were actually opportunities where we found out about different programs and then we got behind them and supported them. Sometimes we can get funding out of what we have, but then other times it's just giving you support. Say you need a student, say you need a literature review, or you need just someone to be able to crunch numbers, do data for you, or something of that sort. You can tap into UIC and we can be a resource for you. I will put it out there. If you need something, I am there to help, whether I can direct you to someone else that's in our community or we can do it ourselves.
She gave me a good segue, so I'm gonna go next. Just a little bit more on the IDPH has a different grant system than if you've applied for other state agencies and then you've had to do your GATA pre-qualification, which is your SAM.gov, your Secretary of State registration, all that sort of stuff. And it does take a while, and there's a lot of hiccups, and there's a lot of qualifications and things that they've given people. So just, Kenya is so right, and I've said it too, and it's not as important as the grant, but it's certainly the precursor to everything. So just make sure you do that. Like, I can help with that part for sure. I can't get too much in the details with the competitive side, but this, getting you set up, I can help you. I have held lots of hands along the way, and I'm happy to do that too. I had one organization, I was about to drive there to help them. I was like, come on girls, you could do this. But no, so some of my, I don't know, maybe you will. I don't know where you guys are all from. I can't imagine if you're from a local place here, you're gonna be applying too many HRSA grants, maybe a few, but more of stuff like I do. some of the stuff Kenya does. And it's not that complicated. And I'm apologizing in advance, but grants have gotten sloppy these days. They're just, from a reviewer perspective, people just are doing them so quickly, I think because we have no time, and they're getting sloppy, or the details are missing, being thorough. There's just a lot of things in a grant. It's almost like a job interview. You end up repeating yourself multiple times sometimes. It's okay. Some of the questions, there's a little overlap, that sort of stuff. But working ahead, that's something they've both mentioned. Get prepared as much as you can to be thorough. I always say never leave a doubt in a reviewer's mind. Never leave any doubts in the reviewer's mind. If you've ever reviewed grants, you become such a better grant writer because you really know what you're looking for. What else we don't see as much anymore? I think a lot of groups have just gotten comfortable. They think they're going to get the funding. And but we still want you to put your best foot forward. What are you doing? What are you going to do with this money? I mean, so much is danced around and things like that. Just cut to the chase. What do you plan to do with it? Don't make us look for it in the grant. And the part of those are our questions. We have to make sure our questions glean those answers that we're soliciting. But really, just be clear. Make it clear. Just what's your plans? Budgets are hard now. Budgets are hard. Budgets are not what they used to be. They're complicated. And what hangs people up when it comes to our grants require that you validate each section. And if you've ever done an eGrams grant, I don't know if anybody has, that's what's happening at the very end. You're like 457 on a Friday, of course, and you're trying to get it submitted and you can't get something validated. And I'm there, but I'm not sure the eGrams people are in their office that I can go ask for help for. Just so, again, don't wait till the last minute. We always encourage you to at least be done 2 days ahead of time. Take advantage, like I said, we offer TA sessions for every grant. We share, if you can't make it or you didn't find out about it, then we're happy to share the FAQs or the PowerPoint that went along with it. Take advantage of all that stuff. Don't feel bad asking too many questions. If you've never done it before, that's the only way you're going to learn. So there's lots of things, but that's kind of the top of my list of what at least I see pretty much all the time when we do these.
Great. So some additional best practices. I think we have a slide from the last session. And actually something that Dr. McRae, you said that just made me remember. So I talked a little bit about the State Maternal Health Innovation Awards in the last session, but another resource that's just helpful, I think especially from a community-based organization perspective. So as Dr. McRae mentioned, all of the State Maternal Health Innovation Grants, which again, another Black Maternal Health Caucus priority, and very thankful for the $55 million that has been made available for us to have this program. But with that program, there is a State Maternal Health Task Force that is a requirement of the grant. So it's a good place to just reach out to get a sense of the pulse of what's in their plan. Are there any places that you can collaborate? So a good resource to reach out to. Also, I mentioned the Healthy Start program. Every Healthy Start program is also required to have a community consortia. So another helpful place that you might want to just tap into, see what kind of initiatives are happening there and if there's any opportunities there. That said, getting into some best practices, again, I think as Dr. O'Connor mentioned, looking at the technical assistance sessions that are given as soon as a notice of funding opportunity comes out, looking at the notice of funding opportunity and looking at the points of contact that you can reach out to for any issues that come up, any questions that you have, and there is always a programmatic person that you can reach out to for questions, as well as someone from the grant side who can help with any issues that come up. And then just some general tips for applying. I think a lot of the things that were mentioned about starting early, because for so many reasons, there are a lot of things that a lot of information that needs to be gathered. It's good to start submitting early, following the instructions, keeping the audience in mind, trying to be succinct and clear to the point. being organized, logical in the flow of things, making sure that all the different pieces of your application fit together, making sure that you have all of those fiscal management documents, paperwork worked out. There was a question in the last session about things you can do ahead. I think it's a great question, and something that is helpful is to just pull up a NOFO, see some of those things if you have an intention of applying that you might be able to just get ahead of time just for any opportunities that come in the future. For individual applications, yes, just making sure your technical details are all straight, making sure things are labeled properly, all attachments are there, and just reviewing everything for accuracy, completion, and making sure you're submitting everything on time.
Just going to clarify, one of the acronyms used was the NOFO, so the Notice of Funding Opportunity, and they're available pretty much with every agency to see when there's funds available, how you apply for it, and so just pulling that up is helpful.
I really appreciate your translations, because sometimes we forget that we're not using real words. And I'm really, that's one of my things to improve. So I have 4 items that I want to share. I'm hoping I'm not going to be duplicative. The first here is, please tell your story. I'm going to say it again in a different way. Very often, individuals will approach you to help you tell your story. Please be the author of your story. Sometimes we all need help with the sentence structure and being succinct to fit into the form, but you know your story best. Enough said. Then, become a reviewer. It is possible for everyone in this room to apply to be a reviewer of federal grant applications. You learn a lot from the other side. So you don't always have to write. Sometimes you can read what others write, and then you learn how things are done. And then it starts to come together in a different way. Sometimes when you have a clear vision, it's hard to know what to put around the vision, the data, the literature review, the research. The HHS, Office of Minority Health, has a knowledge center. It serves as the nation's minority health library. It is available for you online and live. You can just dial a number and you get a person, and they can help you do literature reviews, understand the research that's available. Many grant writers use our library. Please join the ranks. They also have a way of helping you identify other funding opportunities that may not be as large, but they may be more accessible. Everyone has to start somewhere. And last but not least, we also have regional minority health analysts. So like others you've heard, I am a part of a team. And our regional minority health analysts are in each of the 10 regions across the country. There's someone assigned to help you and be an extension of our office to help you know what are the priorities and where you may go within your region to find partners for the applications. So those are my little best practices.
Oh, and just really quickly, I want to share 2 other resources just in case, because you've heard about federal, you've heard about state, but there's also foundation, there's philanthropic funding in all foundations. And so two places that I look and just get information, some have grant writing tips. One is called Candid, Philanthropic. Candid is the name of the group, and it's their Philanthropy News Digest, so PND. So if you actually just put in Candid and then put PND, P as in Paul, N as in Nancy, D as in Derek, you can get to their webpage and you can register for free. They send, you might kill me for this, but they send out tons of emails, but still, at least you're in the know. And the other The other resource that I think might be interesting is called the Grantsmanship Center, tgci.com. T as in Tom, G as in George, C, Charlie, I, Israel, .com. And it's national, but you can get on there and it has like state grant resources, and it actually gives you the top giving foundations in Illinois and provides you a link to them. That's something for you to explore. Maybe there's certain funding, especially with maternal health being so big, the philanthropic world usually jumps on the bandwagon as well. So you might see some things that you might be able to apply for.
Thank you so much, you all, for providing so much wonderful information for us. We have a little bit of time, so I want to make sure that we're able to open up the floor for questions from our audience. And I see one right here in the blue. Right here, yes.
Thank you. Thank you, everybody. I appreciate this. I was in the previous panel as well, and it's the same question. Jenny Joseph, Common Sense Childbirth, and also the National Perinatal Task Force. We're on the ground doing the work. Been on that for 25 years. We've tried really hard to do the things that you've suggested. All of the different agencies are making good suggestions, and I'm grateful for the knowledge. Connecting this to Black maternal health and to the Momnibus, has me curious, given the effort and the solid background that we now have to be eligible as community providers, perinatal workforce, is there any part of the money that's coming out and is available to any of us at this point? Is there any part of that money that's being earmarked inside of the different agencies to really say, let's put this aside to help the folk like me, because 25 years in, I'm still not ready. I haven't got time to be ready, and my teams are exhausted. So I'm not sure how we get to be ready to this part, to get to that money, which is for us to do the work that is necessary to save lives. So just curious, is there a sort of a movement or a possibility of, could we earmark some of this money to put some folk who are dedicated to hand-holding all of us, getting us to capacity, so that we can then move it back down to the next layer of the grassroots?
I can take the question because I think it's a good question, an important one. And so my answer is from the role that I sit in. We receive our appropriation and we act on that appropriation. We do not make the appropriation. So it would be important to look at the source and know that we will follow the directions. And so right now, there is nothing that earmarks us in the way that you've described. But if indeed that comes, then we would have to follow.
Let me just add really quick to that. So we are getting close to releasing a grant for birth equity that's coming. That would be probably, if you're a 501c3 nonprofit, yeah, grab my card before, so at least we, oh, not in Illinois, never mind. Never mind. Sorry. Okay, the rest of you.
Yeah.
Yeah. Yes. Oh, yes, yes. So yeah, it's a birth equity grant that's coming. We're working on it. It's close. I'd say in the next, hopefully, month we'll have something. So get an egrams. I wrote it on a bunch of my cards. Apply, and then when that birth equity goes live, I mean those are for more for those more of the community groups. So it's coming. I think about $4 million total.
To your question as well, we hear you and we understand. Organizations like yours and the problem that you're experiencing is why we are having this session, is because we want groups like yours on the ground doing this work to start building the capacity now, so that when the Momnibus does pass, we're ready so we don't have to get ready. As far as people being able to help you, to be able to hold your hand through these processes, there's of course individuals in our congressional office, there's individuals at the agencies who are more than willing to help and do this, and I'm not going to in any way minimize what you're saying about it being complicated and it being difficult, because it is hard work. But you are not alone, and I want to reiterate that. And so that's why we have these sessions, that's why we have these conversations, so that organizations like yours know about the work that we do, and then we can work together. And I want to encourage everyone here to connect with the leadership on the state, local, and federal level for your communities. You have to have these conversations with the people who are representing you in Congress. You have to have these conversations with people who are representing you on the state and local level, so that we can do that type of work and that we can make sure that those issues are brought to the forefront and memorialized in our appropriations process. So thank you so much for that. Over here.
Hi, I just want to say I thank you for saying that. I'm Ariel from Hustle Mommies and Urban Mom Collective, Black Mom Coalition, and I do want to say I stand in solidarity with you, with those on the ground and the funding. But my question is it better for you guys from a funder's perspective? Because I do work in Chicago, and it seems like those of us that apply on our own do not get the funding. Do you guys prioritize those that coalition build and apply together for funding? Or is there, and I think I asked that earlier, but I wanted to know, especially for Illinois and for the Office of Minority, do you guys prioritize funding together, like applying together and having groups, opposed to like us applying by ourselves?
Go ahead. Yeah.
Okay. So I'm putting back my hat on from when I was at IDPH. So that was one of the big things. I'm going to also hit on your question too as well. One of the things that we were seeing, you get the same people applying for the grants over and over and over again. How do you bring in new people? So one of the things I know IDPH was looking into at the time was having actually some type of grant workshops or something so they could teach and people learn about how to put different things together. I know we had a grant that was increasing well woman visits for community members, but my community members weren't showing up to the table. And those that showed up to the table didn't necessarily put a grant together. But then I had big hospitals trying to come in as well. And I was like, no, you cannot do this. You need to go out there and actually partner with somebody within the community and get that community organization to apply. Therefore you're teaching and they're learning and it's mentoring, and therefore you're building up those that can come in. That's one of the things just because you all just brought that to made me remember, I'm putting that in our blueprint, because how are we we need to be able to fund these CBOs. It might not help you right now at this particular point, but if I can get it in front of the governor's office, we don't know what will happen and how it might take off. But that is a very valid point. You can't expect organizations to apply for something and then you already have a set criteria on what you want it to look like.
Sorry, before we go to our next question, there's another component that I want to memorialize for you all. So in Congress, we have something that is called community project funding. Have you all heard of community project funding? It's also entitled CPFs. CPFs are an opportunity for members of Congress to put before appropriators priorities for funding that will impact their community. It's a way for us to say, this is an organization, this is a project in my district that is valuable, that we need help with, and we need funding for it. We have had some problems over the last few years under a Republican majority House that has made it difficult for us to fund projects that I think would be very relevant to Black maternal health or maternal health more broadly. But we're in an election year, right? And so there's definitely a possibility for a Democratic majority, and under that, it's likely, or it's possible rather, that the criteria for applying for CPFs in this space will change, and it will be opened up to 501c3s and organizations like the ones represented here. So that process typically begins, give or take, at the beginning of the year, the beginning of the new fiscal year. And you will find information about it when you contact your congressional representative. For those who are located in Illinois' 14th district, I'm very proud to say you have a member of Congress who serves on the House Appropriations Committee, who I'm positive would be happy to advocate for funding for you in this space. But even if you aren't in Illinois' 14th District, that shouldn't stop you from reaching out to your member of Congress about the funding that is available to you through community project funding, also known as CPFs.
I also just add, so was mentioned a little bit, but I would also just stress that there are some, at least for HRSA grants, every grant does have a point of contact from the programmatic side as well as from the grant side, that there's contact information for a person. So you can actually reach out to that individual and ask those for that assistance that you need, and they can help you to the extent that is possible to just work through the application, places where you are needing some additional assistance and troubleshooting help, they can help you. In terms of the question that came up around, like, is it helpful to come in as a coalition? It's really about, you know, speaking to the things that are there in the application and putting it through the objective review process. But I think it speaks to that importance of reaching out to the leadership of your local health department, reaching out to the Title V program, seeing where you can build those alliances, and if there are those synergies that are there that help, you know, put together that more impactful application, that's also something that can help support.
I know time's up, but I just wanted to answer your question about partnering, because that was one thing you asked about. I can just speak from us for these birth equity. I mean, these are going to be called Birth Equity Innovation Seed Grants. So, I mean, we're looking at that, you know, more grassroots level type of organizations. And, you know, right now we're looking at $500,000 to $1 million each. So we would definitely be looking for partnerships for that. I mean, that's not something you do on your own probably. So finding those strong partners, finding those, you know, sometimes it is trying to get with those larger groups that seem to be successful and saying, listen, can I be a contractor? Put me on. Giving you a chance to, you know, because it's like it is a situation when it's like this, it is a lot of repeaters, but they write good grants and they know what they got all the resources, and so, you know, say, hey, listen, give me a chance, work with me. I'm the boots on the ground here. I'm the one who, so, you know, maybe that would be, I would, for this volume of money, I would definitely, we were looking for partners, for sure.
I know we're out of time probably, but I just want to say this one part, because I'm hearing an opportunity to clarify maybe in another session exactly what happens in reviewing at least federal applications. And one of the critical takeaways here, in every announcement, there's criteria that the applications are rated against. We have merit review, which means the federal staff who are writing and managing the program are not allowed to review applications. So to your question, we do have narratives about partnership, but at the end of the day, only one entity can be named as the applicant. That's for the Office of Minority Health. Others may do it differently, but only one. Now, you may be the one representing many, but it is important to look at that criteria, because it also lets you know how the points are distributed, and that's intentional. And so when you look there, you get an idea of how to frame your proposal so that when someone who's outside of your community looks at it, they can better understand what you're trying to accomplish.
But if you're a subcontractor, you're still getting some funding from them. So those are, and you're not on the hook as much as the applicant.
Yeah. I think so much of this is about demystifying this process for you all, which is why, again, we were happy to host panels like these. It's why we want to talk to you all about community project funding that you would secure through your member of Congress, previously referred to as earmarks, and some people still calling it that, but CPFs in today's day and age. I want to encourage you all to network at our reception later this afternoon, to please keep in touch with our office, and just understand that there are resources available for you, whether it be through the congressional offices, whether it be through the agencies and their willingness to provide technical assistance, and whether it be through these websites that they have shared with us all. Also, we'll remind you all that we have flyers and information on the bar outside of this room that discuss funding as we have talked about it through some of these panel discussions today. So thank you so much to all of our panelists for joining us. This concludes the formal part of our summit today, and we will have a reception around 4 o'clock for you all to network and to talk. Thank you all so much for your time, and we're happy to have had you this year. Thank you.